All right, let's get right into it. Today, we're going to be medical detectives. We're diving into a really perplexing symptom, weakness in children. And we're going to do it by cracking open two real-life case files to see exactly how doctors piece together this incredibly complex puzzle.
You know, it's a question that could keep any parent or caregiver up at night, right? You see your child and they just seem listless, maybe a little floppy, or just off. So, where's the line? When does being tired become something much, much more? That's the big question we're digging into.
Okay, so every good investigation needs a starting point, a key clue. And for us, that clue is the word weakness itself. See, in the medical world, that word has a super specific meaning. And honestly, getting a handle on that is the very first step to cracking this whole case. So here's the deal. This isn't about just feeling tired or, having low energy. Clinical weakness is a true, measurable physical problem. It's the inability of the muscles to actually generate the force they need to. Think of it as a hardware problem, not just a low battery. All right, so one of the very first things doctors have to do is figure out if they're dealing with weakness or something called hypotonia. That's just a fancy term for low muscle tone. Let's break it down. Weakness is about a lack of force, right? Like you literally can't generate the power to lift a toy. Hypotonia, though, that's a lack of resistance. It makes a limb feel kind of floppy. Now, here's a key distinction. An infant with true weakness, they'll almost always have hypotonia. But, and this is a big but, an infant with hypotonia doesn't automatically mean they have weakness.
And that is why telling them apart is so, so important. See, some things that cause hypotonia can be totally benign, but true clinical weakness, that's a different story. The source material is absolutely clear on this. It is always a sign that something else is going on. It's a major red flag that screams, hey, you need to investigate this. Okay, so we've got our key term locked down. Now, let's open up our first case file. This is where the real detective work kicks in. We're going to follow the clues, one by one, just like the doctors did. So, our first patient is an 11-year-old girl, and her symptoms? Well, they didn't just pop up out of nowhere. It's been a slow burn, getting progressively worse over about a month. And right there, that slow, creeping timeline, that's our very first clue. So the family comes in and they lay out some really concerning symptoms. We're talking difficulty swallowing solid food, her speech is getting hard for people to understand, and just everyday things like getting dressed or climbing stairs have become a huge struggle. You see, these aren't just vague feelings of being unwell. These are concrete, functional problems that are starting to paint a really clear picture for the medical team. And then there's this one detail, pulled straight from the case file, that just, wow. She was having difficulty making a smiling face. I mean, think about that. It's such a human, specific detail. And it's a huge clue that points the doctors toward a very specific kind of weakness, one that's affecting her facial muscles. So next up is the physical exam, and this is where we get the hard data. The doctors notice something called paresis. That's basically a partial paralysis in the nerves that control her face and throat. They test her limb strength, and it comes back at a 2.5 out of 5. To put that in perspective, it means she can move, but it takes a huge amount of effort. And then she has what's called a positive Gower sign. This is a classic. It's when a kid has to use their hands to kind of walk up their own legs to stand up. It's a dead giveaway for weakness in those big muscles in the legs and hips. All right, the evidence is definitely piling up. We've got this clear pattern of weakness that's getting worse over time. So, what's next? How do our medical detectives start to narrow down the list of suspects? Well, let's take a look inside their toolkit. And wow, what a toolkit it is. I mean, it's extensive. You start with blood work, right? You're hunting for any signs of muscle damage or autoimmune problems. Then you might move on to imaging, like an MRI, to get a good look at the brain and spine. And from there, you can get into these really specialized tests that check out everything from nerve signals to spinal fluid, and even taking a tiny piece of the muscle itself to look at under a microscope. But in this particular case, with all those options on the table, it really came down to two tests that blew the case wide open. The first was an EMG, that's electromyography, which basically just measures the electrical buzz happening in the muscles. And the second was something called the edrophonium test. And this right here, this is the aha moment. The edrophonium test, what it does is they inject a drug that works really fast to give a temporary boost to the chemical signals between the nerves and the muscles.
And if the test is positive, you see this incredible, dramatic improvement in strength. It doesn't last long, but it's unmistakable. And for our patient, that's exactly what happened. This was the smoking gun.
And just like that, with that positive test, the mystery was solved. The diagnosis, myasthenia gravis. It's an autoimmune disorder where your own body basically attacks the communication points between nerves and muscles, and that's what causes the weakness. So case number 1, closed. We have a definitive answer. But you know, just when you think you've got it all figured out, a second case file lands on the desk. And this one is completely different. A great reminder that in medicine, no two mysteries are ever the same.
This time, our patient is just a little guy, a 15-month-old boy. And right off the bat, the central clue is a total curveball. His weakness wasn't slow and gradual like our first case. Nope, this was sudden. Like one day he's standing, and the next day, he can't.
So let's just put these two puzzles right next to each other for a second. On one hand, you have an 11-year-old with this slow, creeping weakness in her face and limbs. On the other, a toddler whose legs suddenly just give out. This comparison is so important because it just goes to show how that one little word, weakness, can tell two completely different stories. The physical exam for this little boy uncovers a whole new set of clues. I mean, the weakness score in his legs is actually the same, 2.5 out of 5, but he's also got that significant hypotonia we talked about, that real floppiness. And maybe the biggest clue of all, his reflexes. You know, like the knee-jerk reflex you get at the doctor's office, they're just gone, completely absent. And that points the investigation in a whole new direction, away from the muscles and more towards the nerves. But here comes the twist in this story. The doctors run a whole battery of tests, blood work, cultures, even a lumbar puncture. And nothing. No specific cause, no infection, no culprit they can point to. And that's such a real part of medicine, you know? Sometimes, even with all the best tools, the why just stays a mystery.
So where does that leave us? We've got two totally different cases. One has a nice, neat diagnosis, and the other is a big question mark. So what do you do? What's the path forward when things are this complex and sometimes this uncertain?
Well, the good news is there's a really clear, structured game plan. It all starts with bringing the child into the hospital where the investigation can be done safely. From there, you move to targeted treatment. If it's an infection, you hit it with antibiotics. If it's inflammation, maybe you use steroids. If that's not cutting it, you can move on to more advanced therapies. And then there's the fourth pillar, which applies to pretty much everyone, rehabilitation. Because at the end of the day, helping that child get their strength and function back is always the number one goal.
So after walking through these two cases, we're back where we started. Weakness is a puzzle. And you have to wonder, what's the single most important piece to get started? It's simple, really. It's recognition. It's a parent or a caregiver looking at their child and thinking, you know what, this might be more than just being tired. And then taking that next step, making the call, going to the doctor. That is the move that gets the whole investigation started. It's the first piece that puts the entire puzzle on the path to being solved.